Hey guys, I'm Gursimran Singh Garuda, a physiotherapy intern, and you're watching PhysioMechanist. In this video, I will be discussing on the convex concave rule. So this is the most important rule of biomechanics. To understand the biomechanics of different joints, you must be familiar with this rule. So before coming on to this rule, I will discuss about two terms that are osteokinematics and arthrokinematics. So what is osteokinematics? Osteokinematics is defined as rotatory movement of bones in the space. So let us take an example. For example, uh, while squatting, our femur bends over the tibia and it comes close to the tibia. So during flexion of knee joint, there is closing of the space between the femur and tibia. So this is osteokinematics. There is movement of the femur over the relatively stable tibia. So, but talking about arthrokinematics on the other hand is the motion of the joint surfaces. So there are small motions that occurs at the joint level that are rolling, sliding and spinning. So these are known as arthrokinematics. Now coming on to our convex concave rule. To understand the convex concave rule, we will consider a joint out of which one surface is convex and the other surface is concave. So to understand it better, we will take example of knee joint. In knee joint, femoral condyles represent the convex surface and the tibial condyles represent the concave surface. There are two scenarios in convex concave rule when convex surface move over the relatively stable concave surface. When the convex surface move over the relatively stable concave surface. For this, we will take example of squatting. Our tibia, which is having concave surface, is fixed onto the grounds, but we are bending. So what is happening? The femoral condyles are moving over the fixed tibial condyles. So what is happening? The femur is moving, is bending towards the tibia, and the femoral condyles are rolling, and the rolling occurs in the same direction as that of the movement of femur over the tibia, but sliding occurs in the opposite direction. For example, flexion of femur is there, so rolling is occurring in the posterior direction, but sliding is occurring in the anterior direction. So in convex concave rule, when there is movement of the convex body over the concave surface, the rolling occurs in the same direction as the movement of the bone, but sliding occurs in the opposite direction. So now coming on to the second scenario, that our concave surface is now moving but the convex surface is stable. We take example while a subject is in high sitting. In high sitting, the femur is fixed, the femoral condyles are fixed, and tibia is angulated to femoral condyles at 90-degree, knees at 90-degree angle. Now the subject is asked to extend his knee, straighten up his knee. So position is like this. So when the patient extend his knee, what will happen is the concave surface move over the convex surface. So what is happening? This bone is moving anteriorly, rolling is also occurring anteriorly, and sliding is also occurring anteriorly. So what is happening? Sliding, rolling and movement of bone are occurring in the same direction. So let me show you. So this is femur, this is tibia. So firstly it is at right angle, but then subject is asked to extend his knee. So there is extension of the knee with the movement of femur, with the movement of tibia over the fixed femur. There is rolling and sliding in the same direction, that is anteriorly. So I hope you understood this concept of convex concave rule. To watch more videos like this, like, share, comment, subscribe and press the bell icon. Thank you.